But I just thought I'd open up the members session today to talk about the need to promote occupational health. So you'll see that I've got the WHWB international vision and mission, which is really helping us sort of streamline our efforts. But you'll see in the vision, we're not just talking about workers here, we're talking about families and communities, and I'll talk a bit more about that in a minute. We're also about sharing our expertise and knowledge and skills around the world. And around the world also means underserved populations too in developed countries. And I guess if we think about Thanksgiving being on the 23rd of November in the US, I just think it's good for us to reflect on Thanksgiving and also think about people in places like India and Africa that work in conditions where their health's getting badly affected. I thought I'd use this as an example, this particular work that's been carried out as an example. But this is just a small part of a lot of work. If you think about, the kiln brick workers and, other workers all around the world. I'm just going to focus in the agate workers because I think that just provides sort of a poignant point for what we're trying to promote here. So I think if you think about the agate workers in India, for example, 40% of them are going to get silicosis. And then according to the Hearts of Darkness report, which I've actually provided to a link to, 30% of the 40% will die of silicosis. So their life will be cut short. And so if you think of this fella here as being an agate worker, agate grinder, and you also think about the family members, the children, the neighbours, according to this report, between 6 and 10% of the non-workers will also die of silicosis. So it's a very horrible story when you think about it. And Workplace Health Without Borders has been fortunate to partner with the University of Toronto and also a non-profit group in India called the People's Training and Research Centre to help prevent this horrible disease from occurring. And I've just got a slide here just showing somebody with a scarf wrapped around their face. So, these poor workers can't even afford respiratory protection, let alone, having sort of sophisticated technology or even simple technology just to sort of like isolate the worker from the exposure. So, and also, and I'll talk a bit more about this in a minute. If I just move on. So this is from Institute for Global Labour and Human Rights site. It talks about how the shiny agate stones in jewellery and rosary beads are killing workers. And if you think about the 40% of agate workers in the informal section in India, as I said, many of those will have their lives cut short. And if you actually have a look at the Hearts of Darkness report, there's a statement in there about workers in India, including children, will die young grinding gemstones for Valentine's Day. And this photo here is shared with me from Jagdish Patel, who works for the People's Training and Research Centre. And this is a very sad story. This fellow was actually lying outside of his house, and he was waiting for medicine. But you can see he's actually dying a slow death there from being exposed to silica. So also his parents died from silicosis as well. And if you look at his eyes and you think about him crying out to the world to help him and all his suffering workers, I think that just sends a really powerful message. When I spoke to Jagdish about this from India, he said, "Kevin, I've got many more slides. This is just one example of many." So then he sent me more slides of people dying from either tuberculosis or silicosis. I just think it really sends a powerful message here. And as I said, if you think about the children in their homes where the agate's being polished and ground, the children have been exposed in the past as well, and many of them will have also had their lives cut short from silicosis. But if it wasn't for the People's Training and Research Centre and people like Jagdish Patel, we'd be a lot worse off. So this is the People's Training and Research Centre. So the People's Training and Research Centre have actually set up a daycare where the children have been taken away from the homes where this informal work's been carried out. So they've been taken away from the exposures. I guess if you just look at the centre, though, it's quite a modest-looking centre, and it's just amazing, how these people like Jagdish can have such a big impact. And Workplace Health Without Borders are right behind this non-profit organisation. So if I just acknowledge Lisa Seelan, Paul Bozak, and Om Malik, who are all WHWB board members. They've been to India, and Paul and Om are going back in February. And they're doing this on their own time. And also, when we go to Tanzania, a past board member, Aristides Medard, has been a great advocate for Workplace Health Without Borders as well. And he's been a great catalyst for Marianne Levitsky and Lydia Renton to go over there and provide training through the University of Muhimbili, along with the local academics. And also Aristides played a big part of that as well. And as you can see, Aristides is sharing his own expertise, knowledge and skills that he's actually got from Workplace Health Without Borders. And Aristides, as I said, who was a past board member, is still very closely involved, a strong member of WHWB, has just worked with Jennifer Galvin and our team to develop a World Outreach Initiative technical project proposal on silica dust exposure in stone crushers and in the Tanzania informal sector. So there's a sort of like great work that we're looking at doing there as well. And I just thinking about our volunteers going to different countries to provide training. Is just a picture here of Marianne and Lydia towards the front there, surrounded by all of the students and academics from the University of Muhimbili. We can do a lot more of this work, and we have a lot of well-qualified, well-seasoned occupational health professionals who can get out into these countries through these universities, through these different training forums to provide this outreach. And I think this slide really provides a very powerful picture of work-related occupational injuries and disease. When you think about occupational injuries and disease being 2.3 million worldwide, which is it's greater than armed conflict and violence and road traffic, fatalities combined. So it sends quite a strong message, doesn't it? We just need sufficient funding to provide the necessary outreach, worldwide to developing countries for our many extremely willing and highly skilled volunteers. And I just really want to acknowledge Om Malik here, who is a founding member of WHWB as well. He's done an enormous amount of work to help out. And as I said, him and Paul Bozak are going back to India in February. This presentation, and my part of it, is really promoting the need to go out to fundraisers and sponsors. How do we influence, these potential sponsors, and also how do we influence other fundraisers to help us build our own funds as well?